remember the phone call that I made to my dad. And this is the way I phrased it to him. I think I might have a drug problem. When the reality of it was, I was a full-blown dope fiend.
Nine months ago, I found out that my youngest daughter, who's a nurse, has a prescription drug problem. I've been helping others with it for years. I never imagined or dreamed that it would have happened to me.
He was driving a truck and he turned the truck over onto another truck and killed two men that were inside. And that was a devastating thing to happen. There's no way to describe the pain you feel for other people and for yourself. My husband had a back problem and he started getting prescription drugs to deal with the pain, and he became addicted very quickly to Oxycontin. We had a great business. We attended church together, had a great home. You know, we did everything that you feel like a family is supposed to do.
Somehow tonight I feel lonely, my darling. Somehow tonight I feel blue. Somehow tonight these tears might keep falling. Come back, sweetheart, and be true.
Everything I did in my life revolved around drugs, and that was the point that when I made that phone call, I really had to take a look at it and go, wow, I don't get out of bed unless I'm going to get high. You don't see me unless I'm high.
I wish that I hadn't waited until it happened to someone so close to me. It's not that I didn't care about others, but it just, when it hits in your own home, it changes everything.
Southwest Virginia is a beautiful region located in the Appalachian Mountains. The communities here are rich with history of hardworking, family-oriented people who are now experiencing a drug epidemic that is ravaging its population.
Coalition work can be really hard. And 10 years ago, when we came together and said, what can we do about the prescription drug problem, we decided to come together as a region, and we formed Appalachian Substance Abuse Coalition for Prevention and Treatment. And that coalition serves 8 counties, and they of course have their own coalitions as well. But we thought we needed to take a leadership role in helping to kind of pool all of our resources together and all the professionals and partners in the community so that we could effectively address the problem and kind of pass it down to our coalition specifically in the counties. In order to effectively organize our efforts, we followed the Center for Substance Abuse Prevention's Strategic Prevention Framework. This has allowed us to really effectively assess our community, look at our capacity, plan together, implement programs, and more importantly, evaluate what we're doing to see if it makes a change.
So 200 overdose deaths a year for prescription drugs in Southwest Virginia is a public health problem of epidemic proportions. And we recognized that that was happening earlier in this decade when we began to see a rise in people using Oxycontin.
Opiates such as oxycodone and morphine are commonly prescribed because of their effective pain-relieving properties for the treatment of injury, surgery, and chronic pain. Scientifically, these medications attach to the opioid receptors in the brain and spinal cord, effectively blocking the transmission of pain messages. The brain's pleasure centers are affected, resulting in a feeling of euphoria. Drug side effects include drowsiness, dizziness, nausea, and constipation. Taken in high doses, respiratory depression can fatally occur.
It was the perfect way to get high. It was colorless, odorless, you know, unless I had pill residue falling out of my nose, nobody ever knew I was high. It became my entire world. It was my mom, my dad, my brother, everything. It was the most important relationship, probably to this day, that I had ever had in my life.
One of the frightening things to me is that most of those drug overdose deaths are unintentional. They are not suicide. They are people who did not intend to take their own lives, that are taking too much of too many drugs typically, and they take so much that they fall asleep and they never wake up.
Southwest Virginia is important to us. As much as I've wanted to run from it and fight from it, or fight with it, it's part of who I am. It's my home, so.
Praise God, praise God, praise God, praise God, praise God, praise God, praise God.
Here in Southwest Virginia, we have found ourselves with a problem that primarily concerned with young people and how it's affecting families, and we realize it affects more than just young people, though. It affects our adult population.
1999, we saw basically a revolution in drug use in this area. It completely changed the culture of Southwest Virginia.
As a pastor in a rural community, you kind of have to be aware. You have to make yourself aware that this problem exists in the community. Because if you don't, you can be like an ostrich and stick your head in the ground.
I definitely see other public health implications beyond just the death and disability that these drugs cause.
Everybody knows we have some of the smaller counties in Virginia, but when you consider the substance abuse problems that result in us having to take kids into foster care in age groups from 0 to 17, we have some of the highest rates in Virginia. Our caseload has grown in Southwest Virginia 23%, whereas the state total for foster care kids has actually decreased in Virginia.
We live in an area that has a lot of coal miners, and not as much now, but used to have a fairly large logging industry as well. The mindset of the coal industry is, that's my identity. This is what I do. This is what I do to support my family. A lot of the coal miners, a lot of them, that's all they've ever done, and went and could make a really good living and have really good benefits.
For many years, Southwest Virginia residents have experienced high levels of economic deprivation, resulting in unemployment and TANF rates that are higher than the state average. Over half the children in the region receive free or reduced lunches. Coal mining, logging, and agriculture are viable sources of employment in Southwest Virginia. Residents will often try to keep their jobs at any cost.
So they've been very money motivated, as opposed to really understanding what they were taking and what could come about with taking a prescription medication. You have the coal industry, you have the logging industry, you have all these things that pain issues and serious injury come with. In Southwest Virginia, it was easier to just prescribe a pain medication to take care of the acute pain so I could go back to work.
Somebody who is an employer may see that they have real workforce challenges for employers that need employees to pass a drug screen. For example, if they can't get enough employees that are clean enough to pass a drug screen, that has economic implications for them.
When you talk about the crime problem in Southwest Virginia, you talk about the drug problem. It's synonymous. There's probably 80 to 85% of our crime is directly driven by drug abuse and addiction. But OxyContin basically alerted us to the change in drug abuse and in this growing epidemic of drug addiction in Southwest Virginia. Approximately 1999 and 2000, we realized that we were in the midst of an epidemic. And we realized also very shortly thereafter that what we were doing was not solving the problem, and that we needed to go about this in a completely different way.
I've never had to deal with the types of addictions, though, that I've had to deal with over the last several years, and the number of those addictions. Chemical abuse. We've always had to deal with alcoholism and the effects of alcoholism on families. But now we have prescription painkiller problems. And it's not just those who are prescribed prescription pain pills. It's family members that get those and use those. It's teenagers that have access to those either through someone they know or by buying those. And they're real killers. At one point, we used to see a limited number of deaths in this region due to prescription painkillers or substance abuse. Those numbers have skyrocketed.
At the community college, we have a very diverse group of students, and because of that, prescription substance abuse is a very difficult problem to address. That population is probably most affected from this epidemic, which would be your 20 to 30-year-olds. And unfortunately, there's not a lot out there for prevention with that group.
You know, because if I'm addicted, I'm going to touch the person that lives next door to me. I'm going to touch my cousin that lives over in the next town. I'm going to touch the person that lives down the street 5 miles. And it affects everybody.
I remember one time when I had told one of my friends about my age that my dad was in jail for using drugs. And her mom became upset with me because she didn't want her daughter to know about drugs.
That's something they did not talk about, was addiction and how recovery was possible.
She couldn't understand why that wasn't okay to talk about, because she and I had talked about that, you know, for ever since the problem had started. And she had the comfort level to be able to tell me about that, and she thought it was okay to say that to other people.
We have people that are willing to step up and help, and not afraid to be able to admit that there is a problem.
Family is important here in the Southwest. We're close-knit on a lot of things. We're going tonight to a homecoming football game, and it'll be a wild place. People will be excited. They'll be together and sharing their excitement about the football game.
The family system has always served as the cultural stronghold of Southwest Virginia. Generations of extended families have depended on each other for support and stability through many economic and workforce hardships. However, the prescription drug epidemic has debilitated the family system, and the destruction is far-reaching.
We have significant problems out here with the substance abuse situations within families. A lot of times we have to go out and do CPS investigations, and as a result of that, we end up having to put children in foster care.
Child abuse neglect rates, as well as out-of-home placement rates for children in Southwest Virginia, are twice that of the state average. In many regions, 1/3 of the children live with grandparents as a result of addicted parents who have died or gone to jail. The addicted person often fails to see the impact their use has on other family members until it is too late.
They didn't want to face the fact that their brother was addicted, or their mother was addicted, or their father was an alcoholic. They did not want to face that fact. They didn't want to be stigmatized as people with a problem. They didn't know how to handle the problem. They didn't know who to talk to about the problem. So it was just easier to keep it hid.
You know, one of the excuses that I used to use in the past was I was only hurting me, wasn't hurting anybody else. When the fact of the matter is, I hurt everybody around me way more than I ever hurt me. See, I knew I was killing me. Everybody else had to watch it.
When it hits in your own home, it changes everything. And it affects every aspect of your life. Trust issues. You begin to question everything that the person tells you, whether or not they're telling you the truth, or any assistance that you try to offer that person. Are they going to abuse the assistance that you give them? And being able to try to give them the resources, or my daughter the resources, to get well. And it's a long-term process.
So we need to get back to families learning about each other, how to validate each other, how to, that you want the best for each other. We're just not each out for ourselves.
It's important to move forward. If you're going to deal with any kind of addiction, you're going to have to be able to talk to each other in particular, or to anybody else that, you know, has been a support system for you through the years.
I talk with my mom a lot about my dad, and it makes me feel better. My mom has been honest about all of this over the years because we've talked about it, and some families won't do that.
We need to get back to where our families are working together. I've watched that in our family-based programs where they can help each other, where they build relationships with each other. The families coming in not knowing each other, they leave out of there a little sense of community.
The best thing you can do is talk to people. If you keep it a secret, you're not helping anyone. You're only enabling that person to continue in the abuse, and you're putting your family at a higher risk. You're not alone. And we're really able to do a lot more than we realize.
I'd give advice to kids that has had addiction in their family to try and talk with whoever you're living with about it. It wasn't their fault, it was just addiction. Me and my mom are happy, and we have a lot of hope together.
We went from about 20 clients in a year using prescription drugs to over 500 in 1 year's time. So we were unprepared for such large numbers of people come to treatment. These were the early times of the epidemic in the area here in Southwest Virginia. We didn't have opiate replacement therapies of any kind.
I basically went from being a kid who knew nothing about drugs to realistically within a year's time being a full-blown drug addict.
The parent would say, I don't know what's happened to my child. They're not acting like they used to be a few years ago.
I started writing bad checks. I started lying to everybody around me. Woke up in my apartment with eviction notices on my door. Kept getting arrested for really, really stupid things that I wouldn't have done in the past and haven't done since I've been clean.
A lot of times they would say they were raised right. She was a cheerleader, he was a football player.
I had scholarship offers to play college football. Passed all that up because really couldn't see anything outside of what my addiction was.
They had good grades in school, and now I can't leave them at home. I can't trust them. They're stealing from me. They're writing bad checks. What has happened? What can I do? And these were desperate parents.
One of the instances for me that made me realize that there may be a problem was that I found a straw in his hunting gear and powder on the kitchen counter, different places where he had crushed up pills and snorted pills.
In the early 1990s when I hit treatment, we had 28-day programs. You'd get 7 days of detox and then you'd get 21 days of treatment.
We were detoxing a lot of people with Librium and Clonidine, which we were able to do. You can do it successfully, but it's very difficult for the clients. It takes longer. They're quite ill during that period, and we had a lot of people who left AMA because it was very uncomfortable to go through that.
Prescription drug abuse in general is a new problem, and at least in the area of opioids, certainly in this area it is in the last 10 to 15 years. And anytime you have a new problem that you're trying to address, you don't have the answer already. You have to find the answer. And so we've been doing many things in the last 10 or 15 years to be pioneers in this area and come up with different solutions. Some have worked, some have not, but we've learned from the ones that haven't worked and have changed our plan, and we have things now that do work.
For some time, I didn't want to believe there was a problem either. So you just kind of go on thinking this will go away, or this will get better, or they can stop. But it takes some intervention, it takes some recognition of the problem and admission of the problem.
Since those early years, some things have changed, and sometimes there's debate for what's better or worse. But now we have opiate replacement treatment in Southwest Virginia. That's methadone and also Suboxone treatment. So that is something that wasn't there in the early years. Also, we have some people who have been treated with naltrexone.
No one size fits all. So there is a methadone clinic. For some patients, that's the right answer. We do have inpatient treatment as well. Here we were able to start a Suboxone treatment program, which is the right answer for another group of patients. And so you need to have different solutions for different patients.
One of the things that we started was a drug court program, and to my knowledge, we're the only rural adult drug court program in the Commonwealth of Virginia at this time. I know there are many other counties that are in the process of organizing a drug court, and our drug court has been going strong for 6 years now, 5 to 6 years, and I think that is one of the innovative ways in which we as a community in Southwest Virginia can deal with this drug epidemic.
I knew some people from a 12-step program in that area and called one of them and said, you know, here's the situation. And they said, well, you know what, we'll let you stay with us for the night.
And people need to know that recovery is possible. And with these groups, it gives the people the incentive to get that recovery, to stay clean, and to try to reach out and help somebody else.
I reached out and somebody actually reached back, and it let me see how these programs work and how people in recovery can help one another. So they let me stay on their couch, and the next morning I said, I'm still up in the air about what I need to do. And they took me to a meeting, and shortly after the meeting I went back to the treatment center, because that was like the final straw that made me realize I can't keep doing this anymore.
Hard to believe the explosion of recovery that has went on around here. We've all worked together to do this. It's not just the recovering people, although we do a whole lot of the hard work, but we have some help through the professional people, and that's what it's taken. It's had to be a community effort.
Unfortunately, there have been a lot of people in Southwest Virginia that have actually taken some steps to move their life in a direction that is very, very different from where they wanted to be, and those are the people that I want to be around.
It was like they were struggling to stay alive. And from that time, I have already gotten 8 support groups started, and it has grown from 8 people to 145 people wanting recovery, wanting to know how they can stay clean. They're wanting that help. They're wanting to know there's a life afterwards.
I heard a gentleman speak one time that was younger than I am. He was probably 22, 23 years old. And one of the things that he said was, I needed to get comfortable being uncomfortable, and it made a lot of sense to me because everything I was comfortable doing kept me sick for 12 years. It was lying, cheating, stealing, and everything I'm uncomfortable doing, like saying I was a detriment to society, saying that looking at somebody I lied to or cheated and saying I'm sorry, speaking in meetings, going around and telling my story, saying when I was wrong, things like that are the things that make me better.
So I depend on agencies outside of our church, and it's critical that you know what those agencies are, what they do, and where they are, and what they can offer. So getting a list of resources is critical. It should be on the top of your desk as a pastor, and kept there so that as people come in and are seeking answers to questions, that at least you can provide guidance for them.
Communities in Southwest Virginia have worked hard to develop a continuum of support for recovering folks and their families. Collaborative efforts include the rapid growth of community recovery groups, NA, AA, and Celebrate Recovery, a comprehensive regional resource website, StopSubstanceAbuse.com, recovery peer support professionals, family partner advocate positions, recovery support newsletters.
Well, I think he's more safe when he's in jail because he doesn't have an opportunity to use drugs or anything like that.
And he's actually able to provide some insight now that he had not been able to before. Now he is able to think about the problem and how it affected not only him, but how it affected us and other people in our family, and how it affected other people's families as well.
And if you can catch this thing early, you got a pretty good shot at giving somebody a life that maybe they wouldn't have had otherwise.
Effective prevention has 6 core strategies: information dissemination efforts, educational programming, alternative activities, problem identification and referral, community-based processes, and environmental strategies. We've tried to address all of these throughout our community and continue to build programs that expand these areas. The thing that we're most proud of, I guess, is this media campaign, because we really want people to know what the problem is, to know what the resources are, and to know how they can get involved for their need, whether it be professional or personal, or maybe a recovering person or someone seeking treatment.
Like in the situation with my dad, I don't think that he would have started if he would have known that it would have done all this.
Parents are not alone in helping their children. Community members have worked hard to establish science-based education and alternative activities across school systems and communities. Families are encouraged to learn about these programs. Effective programs lower risk factors and build protective factors in children, establishing a foundation for drug prevention. Involved families make a difference.
As a school system, we've worked very hard to develop science-based prevention over all of our grades. We are a rural area. Schools are a good place to get kids' attention. We have seen results from the drug surveys. Last year in our community, 43 people died from drug overdoses, and none of them were teenagers. Something we're doing is working. One of our main goals is to not only work with community partners, but parents. We're all in this together.
Prescription medication is so much different because you're seeing so many young kids now, college age, etc., that are becoming full-blown drug addicts quicker because it's different from alcohol. You know, the old mindset was I could drink for 10 years before I ever started to see any of the bad things that happened in my life.
Some of the things we're doing is offering classes that directly look at substance abuse, how this problem starts, the different aspects of substance abuse and addiction. We're using social networking, web pages, a lot of different social events, hopefully to bring people on campus to bring to light this problem.
Alternative activities are a great way for the community to become involved with drug prevention. Examples of this would be one-time only events such as after prom parties, graduation parties, ongoing events such as league ball, karate, music programs, or after-school tutoring. It's important for parents and partners in the community to do what they can to provide opportunities for kids just to remain drug-free. The assumption is the more there is to do, the less likely kids are to become involved with drug and alcohol use.
I have to confess our electric bill is ridiculous, but it is a badge of honor for us because our church is used 7 days a week. Everything from financial counseling to mothers who have kids that they're concerned about in school prayer groups, whether it's AA groups or NA groups, Boy Scouts, any type of ongoing youth program or children's ministry. If we can fill their time with things that are good, it leaves less time for them to be doing the things that are bad. We want them to have an encounter with other kids and positive role models, so that they have people in their lives that they can connect to, and people to hold them accountable as well.
We certainly believe in what we're doing, and we believe that the drug testing program has had a positive effect on our company. It has certainly been the incentive that's made a difference for a lot of our employees to avoid substance abuse or to use our employee assistance program in seeking confidential help in dealing with those issues.
We decided that we need to be proactive and start forming coalitions within the community with our school systems, our health departments, business people, individuals who were involved in prevention and also recovery to try to address this on all fronts.
We really have an opportunity, I think, here in Southwest Virginia to make a difference. And it begins with our commitment to pray and be concerned about our neighbor.
And I think the desperation finally got to the point where our communities started pulling together more, because it wasn't just a community here or there. it was across the board. All of Southwest Virginia and our neighbors in other states were suffering through this, so something had to be done. And
it's very important for pharmacists to utilize the prescription monitoring program that is available through the Commonwealth of Virginia. For each patient that comes in with a prescription for a controlled substance, it usually goes through the mind of the pharmacist. Could this be a diverted prescription? Is this for legitimate medical use? And we have to take the responsibility to run the prescription monitoring reports. And so our students are trained how to run these reports, and we're working so that every pharmacist in Southwest Virginia has access to the internet to be able to actually run these reports and help with the diversion problem. Part of the mission of the pharmacy school where I'm on the faculty is that we are educating students from Central Appalachia, and we're reaching the population of Central Appalachia, a medically underserved region. So we have developed a program called PHASE, which is Pharmacists Helping in Addiction Support and Education. It's a student-run organization, but our plans are for the next 2 to 3 years to reach out into the community, offer outreach, offer education, and offer clinical programs where we work with physicians and other substance abuse professionals.
Throughout the Central App region and including Southwest Virginia, you could start to see the presence and the use of prescription drugs some 20 years ago.
We hear our major employers talking all the time about not being able to find employees who can pass drug tests.
We have very large equipment running in very confined spaces that requires 100% attentiveness 100% of the time. There was a number of various training mechanisms that we used to help people recognize and appreciate the hazards of drug abuse in the workplace. Some constant reminders and as in the form of posters or follow-up safety talks to help remind folks of the issues. We embarked upon a zero-tolerance drug testing policy. That drug testing policy can be initiated through normal random schedules that we have in place. It can be triggered by a complaint from a coworker, or it can be triggered based on a supervisor recognizing the signals of drug abuse. The random side of the program obviously is the most robust, and we do those statistically so that 100% of the employees would effectively be subjected to a test on an annualized basis. The results of all the drug tests are all handled privately with the employees themselves, and we only are made aware of an issue where there's actually a failure.
We are one of the few counties in Southwest Virginia to offer random drug testing. Basically, the program concentrates on student participants who fall under the purview of the Virginia High School League. Every 2 weeks during their season, we test 10% of those participants who are actually taking part in their prospective sport or activity. We have found that this program is a wonderful deterrent. It works on the prevention side, and it also allows us to provide intervention when one of the participants violates their pledge.
We would hope the influence in our community would be significant enough to be the appropriate deterrent for kids in school to avoid drug use and remain clean. We obviously have high-paying jobs, and we recruit in these communities aggressively. So hopefully from an environmental strategy standpoint, we're supplementing some of the things that a lot of other programs in our communities are doing so well.
It's a difficult time in our community, but it's also very exciting because we are beginning to take a stand for what we think is a critical need in our community.
I'm proud of the fact that our region in Southwest Virginia and really in Central Appalachia has really come together and begun to coalesce around this problem.
This community's been sick for a long time, and it's about time we healed. And it's possible through all the help that we have here. We really came together.
It's unbelievable what we're doing. So I'd like to encourage you to be a part of that as a citizen in Virginia. It's the only way we'll overcome this problem of substance abuse in Southwest Virginia.
Being involved with the coalition gives me the incentive and gives me a sense of purpose. It gives me the courage to keep on, because my voice is important. My face is important to get out there so people know that they're not the bad guys. The doctors aren't, the behavioral health isn't, the coalitions aren't, the law enforcement aren't. They are just people there trying to help us to get a step further, to bring us up to where they're at, or bring them to the understanding of where we're coming from, because it's not an easy road. And it's not an easy road for them to understand what it's like to be in their shoes.
There's a whole lot of support in this community that there didn't used to be. There's a whole lot of people getting better from this illness, that are getting well, and their lives are going in dramatically different ways that there didn't used to be. You know, the community itself as a whole has finally came together and said, you know what, this isn't just your problem, it's our problem. And that's made a tremendous impact.
My dad's in jail, and it's kind of hard, but I think where he is right now that he's learning and he's spending time off drugs. I love my dad still. He's not a bad man.
It's just amazing how this community has changed, and I'm glad that I live here now. And just in case there ain't nobody told you today that they love you, I do, and there ain't nothing you can do about it.
According to the preliminary rates per 100,000 reported in March 2011 by the Virginia Office of Chief Medical Examiner, prescription drug deaths continue to decline in 6 out of 10 counties in Southwest Virginia. After the recording of this documentary, Southwest Virginia continues to expand its ability to combat the prescription drug problem through new community prevention coalitions, 3 pending drug-free community grant applications, the expansion of support recovery groups to over 125 groups in the region, region-wide prescription take-back programs, drug court recognition by the Virginia Supreme Court, 4 drug court planning courts, Supreme Court application, completion of Project Remote, Rule Enhanced Model for Opioid Treatment Expansion providing these services, development of Medication Assisted Treatment Program, C-Health, Russell County, Intensive Outpatient Program, Lee, Scott, and Wise counties. ASAC has been selected for participation in the Appalachian Regional Commission's 2011 Competition for Community-Based Substance Abuse Prevention Initiatives. The region will use ESPERT, an evidence-based approach for health professionals, hospitals, urgent care facilities, CSB, and health department staff to identify, reduce, and prevent substance abuse and dependence. Training and treatment grants have been secured for the Virginia mining industry to help miners who have lost their certification due to dependence on opiate pain medication. Miners participate in treatment to become recertified and resume their previous careers working in Virginia mines. Appalachian College of Pharmacy Appalachian Aware Program providing these services. ASAC supported the development of the Southwest Virginia Health Authority and the Healthy Appalachia Institute at the University of Virginia's College at Wise Blueprint for Health Improvement and Health-Enabled Prosperity. Congratulations to Dr. Hughes Melton for receiving the American Academy of Family Physicians 2011 Family Physician of the Year. Dr. Melton has been instrumental in bringing medication-assisted substance abuse treatment to Southwest Virginia and is the co-medical director to Project Remote. For comprehensive resources for substance abuse prevention, treatment, and recovery, visit ASAC's website at www.stopsubstanceabuse.com. Resources are county-specific as well as comprehensive, providing links to coalitions, multimedia resources, videos, latest news and events, and specific support to employers, physicians, faith-based organizations, and families. Social media is a low-cost, culturally relative way to interact with your community. Join over 1,500 fans on the ASAC Coalition Facebook page to socially network with others regarding prevention, treatment, and recovery. Together, we can make a difference in our communities.
I don't care if I drink and drive.
I don't care if my parents use drugs. It doesn't bother me.
I don't care if I shoot up drugs.
I don't care that my dad can't keep a job. I don't care if I snort pills.
I don't care if I smoke pot.
I don't care if you smoke pot.
Who cares if I stole drugs from my grandmother's medicine cabinet?
Actually, we do care. You want to know why?
It's our community. It's our responsibility.